Hey guys, today we're going to be discussing Medicare Advantage plans, kind of telling you guys how these plans work, what are the pros, what are the cons, who should look at Medicare Advantage plan, who maybe shouldn't look at a Medicare Advantage plan, just kind of give you everything you need to know about these plans. So as we know, Medicare Advantage is also known as Part C. And Medicare Advantage has been incredibly popular. I think I've read a stat over 50% of Medicare beneficiaries are on Medicare Advantage. So there's definitely a lot of draw to them, and there's a lot of negative publicity, I guess you could say, around Medicare Advantage. Some understandable, some a total lie. So today we're going to kind of, going to talk about Medicare Advantage here. So Medicare Advantage, known as Part C, when you guys go and you get a Medicare Advantage or Part C plan, for instance, instead of having your traditional Medicare and a supplement, you are now getting your care directly through the insurance company. They are becoming the primary insurer, right? So everything is going through them. Why people like Medicare Advantage is the monthly costs. That's what a lot of it comes down to. On most Medicare Advantage plans, you're looking at plans that are about $0 a month, and you have a max out of pocket. So some people are like, oh, the Medicare Advantage, out of pocket's too high, but I look at that as a pro in some cases, right? Because at least you do have a max out of pocket, you do have a stop loss on your plan, so you know that you're not going to owe above that amount. But they can be high in some areas. So you're going to have co-pays, deductible, co-insurance, max out of pocket on your Medicare Advantage plan, very similar to like the insurance you've had through work. Now, another draw to these Medicare Advantage plans is that they have a lot of extra benefits that are included in that at no additional cost. So your dental, your vision, your hearing, fitness membership, transportation, over-the-counter benefits. The list can go on, and the big majority is the dental, vision, hearing that people may want or need. And there's not going to be extra additional monthly costs associated with that on their Medicare Advantage plan. So that is a pro for a lot of people, and that's definitely something to take into consideration. Now, with these plans, you do have a network. Typically, it's an HMO or PPO, right? And you kind of have the more flexibility on the PPO to kind of see who you want in a way. You can go out of network, although you're going to be charged more. So you do have some flexibility in that case, especially on the PPOs nowadays with Medicare Advantage. They do really, work a lot better than they used to as far as, leaving your state and kind of traveling, throughout the country. One of the things that I wanted to talk about is where is all of this coming from as far as people pushing Medicare Advantage? You see a lot of agents, for an example, pushing Medicare Advantage. And one of the reasons that they do that, and I don't agree with this, is you actually get paid more as an agent to sell a Medicare Advantage plan. And while I do Medicare Advantage plans, while I do not think that they're terrible, I don't think that they're right for everybody, and I don't push those plans on clients. And so you'll have a lot of agents that are only gonna talk about Medicare Advantage. They're not even going to get into Medicare Supplement or these other options that you have. It's only going to be Medicare Advantage, and I definitely do not agree with that. On the flip side, you're going to have agents that hate Medicare Advantage and are only going to be showing you Medicare Supplement plans. And I don't agree with that as well, right? A lot of these people that are anti-Medicare Advantage, they don't even tell you that Medicare Advantage exists, or they say, those are terrible, stay away, and they only show Medicare Supplement, which I don't agree at all. What my job, and this is how I view it, is everybody looks at healthcare differently. Everyone's needs are different. Everyone's financial situation is different. And so providing you with both options, here are the pros, here are the cons of each, and letting you decide is what I think most agents should be doing. But some people take, a side and they push one over the other. And I don't agree with that. So that's to say this, Medicare Advantage plans are not terrible, but some people they may just not be the right fit for. So here's maybe a few things to think about as far as who would not choose Medicare Advantage. We kind of already touched on the people that would want a Medicare Advantage, right? Low monthly costs, get your extra benefits, don't really care that you have to stay within the network, right? Maybe you don't travel. Maybe you've gone to the same doctor for 30, 40 years. That's who you see. You don't really care about going anywhere else, right? For the people that may not want a Medicare Advantage plan, the similarities are going to be a few things. Number one is they want the flexibility to really go anywhere they want. Now, I say that because if you go with the Medicare supplement, you have a little bit more flexibility of where you can go, right? As long as they take Medicare, you can go there. So some people like that flexibility, knowing that they can, go to the providers that they want to go to. Number two, maybe you travel a whole lot throughout the country and you don't want to have to worry about, is this, doctor or facility going to be in network, or, trying to mess with all of that to make sure you're in network. On the Medicare supplement, you don't have that, so a lot of people like that. The other thing is, and this is simply just comes down to, people do not want their insurance to be, dictated by, or excuse me, I guess they don't want their health care to be decided on the insurance company. What I mean by that is, if they go in for a test or an x-ray or, a surgery, they don't want the insurance company dictating their care. They want to be able to get the things done that they want to do. The list goes on and on. They just do not want an insurance company sort of being having the final say and dictating what gets done, what doesn't get done. So some people don't really care. It is what it is. I know I'm not going to have an issue getting this done because, whatever the case is, there's some folks that just do not like that. And so that's why some people might not want the Medicare Advantage plan. So I kind of rambled in this video, and I just wanted to really touch on a few different things as far as Medicare Advantage goes, on, what it is, how it works, why it's different, who would want it, who wouldn't want it, and, why they are being, why they are the most popular plan, really. This year and kind of moving forward, we see a lot of people going with Medicare Advantage. Some people because that's the best fit for them. Other times, unfortunately, I think agents push that because their commission's higher, as we talked about. But at the end of the day, Medicare Advantage is not a bad option. It just might not be the right option for you. So that's really my message. Just because Medicare Advantage might not be a great plan or an option for you doesn't mean someone else would not benefit hugely from a Medicare Advantage. So I hope this video helped. Again, if you guys want a true unbiased, opinion and breakdown, please reach out to me. This is what I do. I know this in and out, and I don't push my own beliefs on any of my clients. I tell them what's available, and they make that decision based on their needs. So if you want someone like that that's not going to push one product or the other product on you as, this is it, you need this, then you may want to talk to someone like myself who's not going to be pressuring you one way or the other. So I hope this helps. Again, if you guys have questions or want one-on-one help, or just want to drop something down below in the comments, a question, video ideas, please do so. I hope you guys have a good day.